How does antibiotic resistance make H. pylori harder to treat? Imagine trying to get rid of a stubborn weed in your garden that keeps coming back no matter how many times you pull it out. That's similar to what happens with Helicobacter pylori when it develops antibiotic resistance. This bacteria infects the stomach lining and is a major cause of peptic ulcers and other digestive issues. To eliminate it, doctors usually prescribe a combination of antibiotics along with medications that reduce stomach acid. But when H. pylori becomes resistant to antibiotics, it makes treatment much more complicated. Antibiotic resistance in H. pylori happens because the bacteria mutate genetically, which changes how they respond to drugs. These mutations can make antibiotics like clarithromycin, amoxicillin, and levofloxacin less effective or even useless. When resistance develops, the success rate of standard treatments drops significantly. For example, the usual triple therapy, which combines clarithromycin, amoxicillin, and a proton pump inhibitor, used to work about 80% of the time. But with rising resistance, that success rate can fall much lower, leading to more treatment failures. Some strains of H. pylori have become resistant to multiple antibiotics at once. This multi-drug resistance makes it harder to find effective treatment options. Doctors may need to use more complex regimens, such as bismuth quadruple therapy, which includes bismuth, 2 antibiotics, and a proton pump inhibitor. Sometimes, they have to turn to salvage therapies that involve different antibiotics like rifabutin or levofloxacin. These options are often more costly, may have more side effects, and requiring careful monitoring. Resistance rates can also vary depending on where you live and your personal health history. In some regions, resistance to amoxicillin has become so common that it's no longer a reliable choice. Because of this variability, doctors often prefer to perform antibiotic susceptibility testing or genotypic resistance assays before starting treatment. However, such testing isn't always available everywhere, so physicians must rely on local resistance data and patient history to choose the best antibiotics. The impact of antibiotic resistance on peptic ulcer disease is significant. If H. pylori isn't eradicated, ulcers can persist or recur, increasing the risk of complications like bleeding or perforation. Persistent infection can also lead to ongoing inflammation and damage to the stomach lining, making healing more difficult and prolonging patient discomfort. This means that treatment may need to be more aggressive or prolonged, which can be challenging for patients. To combat resistance, healthcare providers may extend treatment durations, increase the doses of proton pump inhibitors, or add bismuth to regimens. They might also switch to alternative antibiotics such as rifabutin or use combination therapies designed specifically for resistant strains. Patient education about medication adherence is crucial, as missing doses can promote further resistance and reduce the chances of successful eradication. In summary, antibiotic resistance makes treating H. pylori much harder because it reduces the effectiveness of standard therapies, increases the likelihood of treatment failure, and often requires more complex and personalized approaches. This resistance is a major challenge in managing ulcers and preventing their recurrence. It highlights the importance of appropriate antibiotic use, susceptibility testing when possible, and following treatment protocols carefully. Always consult with a healthcare professional for personalized advice and the most effective treatment options.